Hello, I'm Dr. Molinas, Associate Veterinarian at the Richmond SPCA. Parvovirus is a potentially fatal virus that especially attacks dogs with poor immune systems, usually seen in dogs under 6 months old or those that are under-vaccinated or in high-density housing like animal shelters. Parvovirus is highly contagious, spread primarily through the fecal-oral route, meaning direct ingestion of feces from an infected animal. Parvovirus is very hardy in the environment, surviving for months to years in the right conditions. So inanimate objects like people can also spread the disease easily. Parvovirus attacks cells that rapidly divide, primarily the cells of the bone marrow and the lining of the gastrointestinal tract. This results in weakened immune systems and inability to absorb nutrients and water. The most common signs seen for parvovirus puppies include inappetence, lethargy, vomiting, and/or diarrhea. Parvovirus is deadly because it causes inability to absorb nutrients and can cause extreme dehydration. On top of that, by removing the intestinal lining, it allows for bacteria to move from the intestines into the bloodstream. With a weakened immune system, that can cause body-wide infection. A lot of what we have to do for treatment is intensive care to help nurse them through until their body can eliminate the virus on its own. This includes IV fluids, replacing electrolytes, nutrient support, pain medications as it can become very uncomfortable in the intestines, intensive antibiotics. Recently, there has been developed something called a monoclonal antibody treatment, where an antibody attaches to the parvovirus and renders it unable to enter the cells that it likes to attack. The Richmond SPCA has started instituting that treatment in 2025. In general, with parvovirus treatment, intensive treatment, puppies have about a 90% survival rate. If they survive through the virus, they typically have no long-term effects. There is one study that is looking into the possibility of chronic gastrointestinal upset from these dogs later in life, but in general, quality of life is excellent, and once they make it through the parvovirus initial infection, they have no issues from the virus. Parvovirus is not zoonotic, meaning it cannot be spread to people. Once dogs make it past 3 to 5 days of intensive treatment, they usually are on the road to full recovery. However, they can still shed the virus even after they've clinically recovered. We don't know exactly how long a dog sheds the virus after recovery. In general, it's about 3 weeks, but it has been shown to be up to 6 weeks. Here at the Richmond SPCA, we recognize the longest possible shedding period. We recommend isolation from other dogs for 6 weeks from the first positive parvovirus test. When considering adopting a parvovirus positive pet, an adopter who has a dog in the home should contact their veterinarian to ensure that their dog is fully vaccinated for parvovirus. The home should be set up with separate isolation between the two dogs so the parvovirus positive animal is isolated for 6 weeks past the parvovirus positive test.